newest, incredibly effective, non-surgical treatment for those who are suffering from chronic joint pain. How I got involved with this was because of a good friend of mine who could no longer play tennis, had his knees injected. He was supposed to have knee surgery, and within a matter of a month or two, he was back on the tennis courts. Told me all about it. I started looking into it and trained, got certified in it so that I could help other people not have knee surgery. So, if you or someone you love had been diagnosed with bone, joint, ligament, tendon, muscle, or even a nerve problem, today's information could change your life. And we're going to introduce you today to something that's new in the healthcare field. It's called regenerative medicine. Most doctors do not know about this because it's not taught in schools yet. But we're going to talk about that a little bit more. Regenerative means, by definition, to bring into existence again. And in our practice, we use human cellular tissue products and the protocols designed to heal and restore your injured and painful area to as close to normal as possible. Now, when a woman has a live cesarean delivery, they can actually volunteer to donate the umbilical cord, the placenta, and the amniotic fluids that surround the baby. This tissue is carefully screened for any form of disease, and no abortions are involved. Now, as I said, regenerative medicine is kind of new. It's about 20 years old, and these methods are being studied in the most major universities throughout the world. It's amazing what they're finding and what can be done. The protocols that we use in our clinic have been given to us by a team of medical advisors who specialize in regenerative medicine procedures. Now, healing occurs when the 200 plus growth factors and controllers of inflammation, it's called cytokines, are transplanted, and your dormant cells are signaled to take a healing action. Now, as we age, our stem cells become dormant and non-functioning. After we have reached full bone growth, which is about in our late teens or early 20s, we only have about 10% that are active to keep us healing for the rest of our lives. So, by transplanting the correct tissues in the correct amount into the injured or painful part of your body, we can activate those dormant cells that can regenerate new tissue, reduce inflammation, and restore normal function. Well, most people, when they're experiencing pain, they often use drugs. But this does not stop the degeneration. These were only designed to help you get rid of the pain for a short period of time. However, your body now becomes unaware of the injured area. And this can actually worsen your problem. In fact, non-steroidal anti-inflammatory drugs like Advil and Aleve may make you feel less pain, but over time, they destroy your cartilage. And authorities only recommend 3 cortisone shots in any one joint in your lifetime because more can harm you. Now, according to the National Inpatient Medicare Database, 4,964 deaths due to knee replacement surgeries were reported in 1 year. Now, if you add all the blood clots to the lungs, heart attacks, pneumonia, and other related problems to the surgery, it's another 10,000 people died. But this does not even include the 17,500 people who were reported to get infections after the surgery. Look, a knee replacement surgery can cost an average of about $57,000 and is followed by 3 to 6 months of rehabilitation and healing. If you stand a lot, you cannot go back to work for 3 to 6 months. If you sit most of the time, then you probably could go back after about 3 to 4 weeks. That's a lot of downtime. Now, Even with good insurance, the deductible and the copay could cost nearly $15,000 to $20,000 for many people. Now that's with osteoarthritis. These people spend $120,000 in their lifetime with normal conventional care. So let's look at a new solution to the problems that you have. Now, for regeneration to occur, the body cells need the ability to rebuild the injured area. This is what our procedures focus on. These rebuilders are transplanted from vigorously screened tissue donated at the time of the cesarean birth. Now, these transplanted tissues help your body with reduction or elimination of pain, reducing inflammation, minimizing scar tissue, promoting soft growth of the tissues, and regenerating new bone, cartilage, muscle, ligaments, and even nerve. So human cellular tissue products procedures can bring your body what's necessary to help your body heal. Problem is, some doctors use only hundreds of thousands or even just millions of these cells because it keeps their costs down. Thus, they make more money. We use billions to help your body heal naturally. Now, the choice is up to you. You can take drugs to reduce your symptoms for a while. You can have the surgery, if possible, with all the side effects, or you can receive regenerative medical procedures to stop or reverse the degeneration. Because this tissue, we use it's an immunoprivilege, which means you can get this tissue and we don't have to match you because there's no requirements. This tissue is very safe. It is not a cell. Stem cells are cells and they carry DNA. We don't use stem cells. We use something better. So I hope you take my recommendation. I hope you'll give me a chance to show you, because there's a lot of information I want to make clear to you. And I hope you allow this to take place, because there really is no downtime. I just ask for about a day of you taking it easy. If, again, you stand a lot, just do it a little bit at a time. You'll increase your time standing. But normally, everybody so far has been back to work the next day. Now, if you're a football player on a professional team, I'm going to ask you to take some time off. But if that's not what you do, if that's not your daily life, you don't need downtime. So, everyone that has done it has praised me and congratulated me on doing this for them. See, I'm trying to stop as many knee surgeries, shoulder surgeries, etc. So, thank you for listening. I hope to see you soon. Bye.